My name is Sarah Jones, and I'm from Colorado. And after hearing all these stories about people who've been so ill, I'm very lucky I found Poly MVA in the beginning. In February of '02, I found a lump in my breast, and the doctor couldn't see me for 3 weeks. And then she saw me and said, "Yes, you have a lump." And then 3 weeks later, I could have an ultrasound. So I had the mammogram and I had the ultrasound. And during that 6 weeks, while I was waiting, I did a lot of reading. My husband is president of Cavitat Medical Technologies, and we believe in alternative health. So we read a lot. I read Dr. Joseph Issel's book, Cancer, A Second Opinion, in which he said he thought it took about 5 to 7 years for a tumor in the breast to be able to be felt. So by the time I had the mammogram and the ultrasound, and they confirmed that I think I had 2 or 3 lumps, one was large, and they wanted to do the biopsy right then. My husband had made me promise not to do that because we thought that probably added to metastasis. So they put a lot of pressure on me. They were quite rude, and they insisted that I have a biopsy, and I said no. And the radiologist stormed in, and she said, "I can guarantee you 99.99% that this is cancer by the shape of the cells." And I said, "Well, why then do I need a biopsy?" So they were furious. And they said, "Well, why don't you want a biopsy?" I said, "Because I think, it could provide an escape route for these cells." And they said, "That is silly." And I said, "Well, do you have research papers that show it doesn't?" "Well, no, and I said, "Well, I'm just not going to have it." And the nurse actually said to me, a nurse, "It's just a little tiny hole. The biopsy makes a little tiny hole." I said, "How big is a cancer cell?" Well, they didn't know that. So they put on my chart that the patient refused to have a biopsy because she had holistic beliefs. So they put a lot of pressure on me, which I did not appreciate, and that made me even more angry. So in this 6 weeks, my husband had learned about Poly MVA, and he had talked to some other breast cancer survivors for me, and they had had good results. And so we decided, why don't we do this? If it reduces it, fine. If it doesn't, I'll have surgery. Because of Dr. Issel's, it's not the crisis, you have to do it tonight like they thought. So I did that. I started taking the Poly MVA in May, and every 6 weeks I had an ultrasound, and the tumor consistently shrunk. It's been a year. This May, the tumor is not appearing on ultrasound, and my OB/GYN doctor confirms that she can no longer feel it. So all I did was MGM3 when I first thought I had the cancer, started the Poly MVA in May. I had I'm taking a lot of supplements to correct my amino acid imbalance. I haven't missed a day of work. I haven't been sick. I don't have any scars. I didn't have radiation, didn't have a biopsy, and no chemotherapy. I believe that dental toxins from root canals cause these cancers to start. My husband's doing protein research now, which is proving these theories. And you all should think about that connection, because people think cancer starts from radiation and toxins, and the toxin that we're all exposed to every day, every hour, are root canals or improperly pulled teeth, which start these lesions in your jawbone. So I believe that's what started it. I thank Al Sanchez and Poly MVA for being there, because it killed the cancer cells. I had the root canals removed and the bone treated, and I took the MGM3, and I'm taking supplements, and I feel very, very well, and it's been a year and a half. I started with a loading dose of Poly MVA, and now I'm down to 4 teaspoons a day, and I may take it forever.